It's the fastest growing school at the University of South Dakota with good reason.
We have a really powerful system of healthcare in South Dakota without question, but they're also really good jobs. Those students know that when they graduate, they're going to come out with a really good job.
The 2,400 students enrolled in the School of Health Sciences are spread among 9 departments and 13 major degree programs. They're entering some of the most in-demand fields in the state.
Some industries growing as much as 13%, some more than double that. So there's high interest in those students, from the students as well as from the industry. The industry is continuously also letting us know that they have a demand for these roles, and healthcare is something that's absolutely critical in South Dakota.
Students like Brooke Miller know there will be careers waiting after graduation. She still has a year left in her nursing program and already has a full-time job lined up.
Nursing's been great. I've learned so much in the past year. We get to go into different hospitals, different settings, work hands-on with patients. There's no better way to learn than be right in the action and get that experience for ourselves.
She also will leave college with multiple internships on her resume, including one this past summer with the South Dakota Women's Prison.
So that was a very unique experience, very awesome. I learned so much. And then this coming summer, I'll be doing an internship in a hospital setting with labor and delivery. So I'm very excited about that.
And once her degree is in hand, she knows a job is waiting.
I plan on going back to Pierre, working in there, giving back to my community. I've always loved that small town community. They definitely need nurses everywhere, and not only South Dakota, but the Midwest region of the U.S. So as much as there's a need, I wasn't prepared for job offers, but yes, they're definitely looking, and I was excited to know I had a job.
She's far from alone. Employers nationwide recruit USD nursing graduates.
We see lots of demand for nursing. Nursing is a very popular profession. And here on the Vermillion campus, our capacity is 64 students, and every fall we have a waiting list.
The school's competitive dental hygienist program also has more demand than capacity.
We currently we run 2 dental hygiene clinics, one in Sioux Falls and one here on campus in Vermillion. And they do provide care to a lot of people who are underserved and otherwise they don't have the capability to seek dental health.
Last year, USD dental students provided care to more than 4,000 people through the clinics, in addition to in prisons and on reservations.
In addition to learning in the classroom, they also provide community service and public service through the clinics that we have and the outreach programs that the dental hygiene program provide.
Undergraduates also can enter the School of Health Sciences unsure of which occupation they would like to pursue.
We have the undergraduate health sciences program where the students can get into the program and they can start taking courses that when they figure it out, they can go into any of our majors. Also, the undergraduate health science program prepares our students for the physician assistant program, which is a graduate program, the physical therapy program, and the occupational therapy program. So we see lots of also excitement about the undergraduate health science program.
USD is hoping to grow the program once it's able to modernize and expand its facilities.
We have a dated residence hall that we've tried to continue operating. However, it's become more efficient to replace that building than to continue on with the one we have now. And by replacing that, we can have a modern facility that will allow us to expand these programs, get those students in that are waitlisted, as well as fuel the workforce then, because there will be more graduates available to our employers.
In Sioux Falls, USD also is helping prepare students for healthcare jobs of the future. It now offers undergraduate and graduate biomedical engineering programs.
It's really an emerging industry here in South Dakota. And we're finding that our graduates from the PhD program stay in South Dakota. We've had 20 graduates, 12 of which are leaders in the state right now.
Tim Hartman is one of those original biomedical engineering undergraduates.
I'm more of an equipment kind of person than working with patients. I'd rather work with machines. And this allows me to do that. I work with high-tech microscopes and stuff like that. So it's something that I'm interested in, so if I go for a graduate degree, it'll probably be in something related to bioinformatics, computational biology.
He's found he enjoys working with image analysis software, a skill in growing demand in healthcare and an example of how the biomedical field is evolving.
It's a field that's not going to just fade away. It's going to become much more advanced, much more targeted.
The place where he takes his classes is a unique setup for biomedical students and an intentional approach to both economic development and workforce development.
I think it's also an incredible opportunity. Having the graduate education and applied research facility right there on site, we have had several businesses, startups incubate there and really get a start. And in fact, one of the future tenants of the Discovery District, Alument, is currently in that building and waiting for the construction of the new facility. And then there's the Community College for Sioux Falls, and the students that will be attending there will be offering degrees that will support the types of industries and businesses that we bring into the Discovery District. And I think that's a natural sort of collaboration that can occur between the community college and those future employers to really fuel their workforce at that site.